Scene script. Have you ever wondered why healthcare costs seem to be skyrocketing with no end in sight? It's a question that has left many of us scratching our heads. As we step into this complex world of healthcare, it's crucial to understand that the costs are not just about the dollar sign you see on your medical bill. There's so much more hidden beneath the surface. Healthcare costs are rising at a pace that outstrips inflation, putting an immense strain on households across the country. Imagine a world where your income is stagnant, but every year the price of essential healthcare services continues to climb. It's a reality that many of us are grappling with. The affordability of healthcare is not just a personal issue, it's a national concern. And the challenge doesn't end there. Unraveling the tangled web of insurance policies further complicates the issue. In the next few minutes, we will delve into the harsh realities of healthcare costs, insurance, and how they impact us all. To understand the gravity of the situation, it's crucial to look at the numbers. Let's dive right into the heart of the matter. First up, let's talk about the annual healthcare expenditure. On average, an American spends nearly $5,000 on healthcare each year. Yes, you heard that right, $5,000. That's more than what most people pay for their annual mortgage or college tuition. Now let's take a look at the uninsured population. As of 2021, it was reported that approximately 8.5% of the population, or nearly 27 million people, were without health insurance. That's almost the entire population of Texas. Imagine the entire state of Texas without any health insurance. But it doesn't stop there. Over the past decade, the cost of healthcare has skyrocketed. From 2013 to 2023, the average annual healthcare costs for an American family increased by a whopping 60%. In contrast, the median household income only rose by about 20% during the same period. This disproportionate increase has made it increasingly difficult for many families to afford necessary healthcare services. Furthermore, the high cost of insurance premiums and out-of-pocket expenses have deterred many from seeking medical help. Studies show that 1 in 4 Americans have skipped medical care because they couldn't afford it. That's a quarter of the population choosing to risk their health due to financial constraints. And let's not forget about prescription drugs. The United States spends more than any other country on prescription drugs. On average, an American spends over $1,200 per year on prescription medications. That's nearly triple of what people in other developed countries spend. These numbers paint a stark picture of the challenges many people face when it comes to healthcare. The high costs, coupled with the lack of insurance, have put immense pressure on millions of Americans. And as we will see in the next scene, the impact of the COVID-19 pandemic has only added to these challenges. The COVID-19 pandemic has further complicated the healthcare landscape. This global health crisis has created a ripple effect that extends well beyond the virus itself, throwing into sharp relief the challenges and vulnerabilities of our healthcare system. First, let's talk about the increased costs associated with treating COVID-19. The necessary protective equipment, ventilators, and other medical supplies quickly became scarce commodities, driving up prices. Furthermore, the cost of hospital stays for COVID-19 patients, particularly those requiring intensive care, has been staggering. These financial burdens have fallen on hospitals, insurance companies, and unfortunately, in many cases, on the patients themselves. But the impact of the pandemic on healthcare costs doesn't stop at the hospital door. With millions of people losing their jobs due to economic shutdowns, we've seen a corresponding rise in the number of uninsured Americans. Many of these individuals had their insurance tied to their employment, and when they lost their jobs, they lost their health coverage too. This has led to a surge in out-of-pocket healthcare expenses, leaving many to grapple with medical bills they simply cannot afford. Moreover, the pandemic has put an immense strain on our already stretched healthcare system. Hospitals and healthcare providers have been overwhelmed with the influx of COVID-19 patients, leading to longer wait times and delayed treatments for non-COVID-related health issues. This not only impacts the quality of care, but also adds to the overall costs. The COVID-19 pandemic has also exposed the deep-seated inequities in our healthcare system. Those who can least afford it are often the ones who bear the brunt of these increased costs. This has only served to widen the gap between the privileged and the underserved in our society. In the end, it's clear that the pandemic has not just been a public health crisis, but a financial one as well. It has underscored the urgent need for reform in our healthcare system, from how we fund and deliver care, to how we ensure that everyone, irrespective of their financial status, has access to quality health care. The pandemic has only amplified the existing issues with our healthcare system. As we navigate the complex world of healthcare costs, it's important to understand the obstacles that stand in our way. One of the biggest challenges is the high administrative costs. In the United States, about a quarter of healthcare spending goes towards administrative tasks. That's because our healthcare system is fragmented and complex with multiple insurance companies, each with its own set of policies and procedures. This complexity necessitates a large number of administrative workers, which drives up costs. Another major roadblock is the lack of price transparency. Imagine going to a restaurant and not knowing the cost of your meal until after you've eaten. It sounds absurd, but that's exactly what happens in healthcare. Patients often don't know how much a procedure or treatment will cost until they receive the bill. This lack of upfront pricing can lead to surprise medical bills and financial hardship. The high cost of prescription drugs also contributes to the issue. In the United States, drug prices are often much higher than in other developed countries. That's because there are no regulations to limit what drug companies can charge. So if a drug is the only treatment for a certain condition, the manufacturer can set the price as high as they wish. These factors all contribute to high insurance premiums. Insurance companies have to cover these high costs, so they pass the burden onto consumers in the form of higher premiums. This is a vicious cycle. High healthcare costs lead to high insurance premiums, which in turn make healthcare even more expensive. To add to the complexity, insurance companies often have a network of preferred providers. If a patient opts for out-of-network care, they could face significantly higher costs. This limits patient choice and can lead to delays in care. These roadblocks make it difficult for many people to access affordable healthcare. The challenges are complex and interwoven, but understanding them is the first step towards finding solutions. As we move forward, we must focus on reducing administrative costs, increasing price transparency, and regulating drug prices to make healthcare more affordable for everyone. Despite these challenges, there are potential solutions on the horizon. One such solution lies in implementing price transparency. Imagine a world where every medical procedure, every prescription drug, every hospital stay comes with a clear upfront price tag. This level of transparency could empower patients to make more informed decisions, potentially driving down costs through competition. Another key strategy is reducing administrative costs. In the United States, administrative costs make up about 25% of total healthcare spending. That's a quarter of every dollar going to paperwork, not patient care. By streamlining processes and leveraging technology, we could see a significant decrease in these costs. But perhaps the most impactful long-term solution is promoting preventive care. It's been said that an ounce of prevention is worth a pound of cure, and in healthcare, this couldn't be more true. Encouraging regular checkups, healthy lifestyles, and early detection of diseases could drastically reduce the need for costly treatments down the line. Of course, these solutions cannot be implemented in a vacuum. It requires the concerted efforts of both the government and the private sector. Government initiatives could include regulations for price transparency, investments in health technology, and policies encouraging preventive care. On the other hand, the private sector could innovate in areas like telemedicine, digital health records, and personalized medicine. Moreover, insurance companies have a role to play too. They can create policies that incentivize preventive care, negotiate lower prices with healthcare providers, and offer plans that are more affordable and accessible. While these strategies may not solve the healthcare cost crisis overnight, they represent steps in the right direction. They offer a vision of a world where healthcare costs are transparent, administrative processes are efficient, and preventive care is the norm. By exploring these solutions, we can begin to envision a future where healthcare is accessible and affordable for all. Understanding the challenge is the first step towards finding a solution. And we've walked through that challenge today, unraveling the complexities of healthcare costs, insurance, and access, particularly in the wake of the COVID-19 pandemic. We've delved into the numbers, the roadblocks, the impacts, and the potential solutions. We've seen how these issues intertwine, creating a web of challenges that can seem daunting. But we've also highlighted strategies and solutions that can help us navigate towards a brighter, more equitable future. However, the journey doesn't end here. The conversations must continue. The fight for affordable, accessible healthcare is a collective one. It's on us to educate ourselves, to understand these complexities, and to advocate for necessary changes. This is our call to action. This is our moment to step up and ensure that everyone, regardless of their socioeconomic status, can access quality healthcare. Together we can work towards a future where healthcare is a right, not a privilege.